Mrs. Vanderbaker was hospitalized for brittle diabetes. It is 2 p.m., and she rings the head desk to inform the nurse that she is feeling lots of discomfort. The nurse immediately goes to her bedside.
Hi, Mrs. Vanderbaker. My name is Philip, and I'll be your nurse tonight. I see that you rang the head desk. Is everything okay?
I'm hot and I'm feeling weak. I think my vision is getting blurry.
Now, is it the first time that you have felt this type of discomfort?
I usually feel this type of discomfort when I'm experiencing a hypoglycemic episode.
The nurse needs to ask questions to the client in order to detect the presence of clinical signs of hypoglycemia.
Now, did you eat well at lunch today?
No, I was given an insulin shot before eating, so I had no appetite.
Okay, so you might be having a hypoglycemic episode. I'm going to go get my glucometer, and we're going to check your blood sugar levels.
Excellent. I'm eager to know the result.
The nurse verifies the content of the case to make sure it contains all of the material required to proceed. The case must contain lancets, test strips, alcohol swabs, rayon balls or non-sterile gauze, disposable non-sterile gloves, and a blood glucose monitor. The nurse turns on the blood glucose monitor. He must fully comply with the operation instructions provided by the manufacturer. He puts on non-sterile gloves. Wearing gloves prevents the nurse from coming into contact with the client's body fluids and also counters the transmission of pathogenic agents. He then chooses the puncture site, which in most cases will be the lateral side of a finger. He must avoid sites with edema or one that has recently been punctured.
Is there a finger that you'd rather I use for the test?
It does not matter to me, whichever one you prefer.
Okay, so we'll go over here.
The nurse disinfects the puncture site with an alcohol swipe and lets it dry. It is important to always allow enough drying time after disinfecting with alcohol. Doing so will ensure the effectiveness of the antiseptic and avoid a burning sensation during the puncture. The nurse takes the lancing device, removes the safety cap, and places the tip of the device on the lateral side of the client's left index finger. He then presses firmly to activate the device's needle and puncture the skin. In certain cases, it might be necessary to massage the fingertip or apply heat for 1 or 2 minutes before puncturing. This will increase blood flow and provide a sufficient amount of blood for the test. The nurse must wipe off the first drop of blood since it could contain interstitial or cellular fluids that may dilute the sample and provide a false blood glucose reading. He places a reactive test strip on the blood drop to absorb the latter through capillary action. He then puts down the monitor and waits for the result. Using a cotton ball, he puts pressure on the puncture site to block the capillaries of the skin.
Okay, so I see that your result is 3.6. So you're definitely having a hypoglycemic episode. I'm going to go check the general prescription, and I'll be back. Okay, just want to pressure on that for me. Thank you.
The nurse puts the used lancet and reactive test strip in a biohazard container and removes his gloves and throws them away in the proper receptacle. A normal blood glucose level ranges from 3.9 to 6.1 millimoles per liter. In order to counter the client's hypoglycemia, the nurse must quickly administer 15 grams of fast-acting sugar. For example, juice with an added bag of sugar or 15 millimeters of maple syrup or honey diluted in it. The nurse comes back 15 minutes later to measure the client's blood glucose level again. At this moment, the nurse's following intervention will be in accordance with the result obtained. To end, in order to standardize nursing practices throughout the network, each hospital has a general prescription regarding hypoglycemia correction.